Nowadays, more and more people are using smartphones, which may cause phone addiction issue in most people. So, what is phone addiction? Phone addiction is the obsessive use of a smartphone. The behavioral addiction is often dubbed as nomophobia, or the fear of being without a mobile device. There are over 3.8 billion smartphone users in the world. Research published by Virgin Mobile discovered that those billions of smartphone users receive 427% more messages and notifications than they did a decade ago. They also send 278% more text. The rise in phone use seems like a natural necessity for a modern life. However, it can also cause concern and negative consequences. The heavy use of these devices has consumers questioning their cellular habits. According to Google Trends, since 2004, search for cell phone addiction have been rising. Chronic phone use is a recently developed form of addiction. The American Psychiatric Association does not officially recognize the condition. Still, it is acknowledged as a behavioral addiction by many medical professionals and researchers worldwide. According to several studies, over time, the devoted use of smartphones can alter and negatively impact an individual, much like gambling.
Phone addiction may lead to sleep deficit, lower concentration, creativity blocks, anxiety, stress, loneliness, impaired relationships, and psychological disorders. Chronic phone use can also cause other physical dysfunction and a loss of gray matter in the brain, which are highly correlated to substance use disorders. Suicide. It's important to note that there has also been a rise in depression and suicides among teenagers in recent years correlated to phone addiction. Adults and girls are particularly susceptible to the risk. According to the Centers for Disease Control and Prevention, between 2010 and 2015, the suicide rate rose by 65%. At the same time, the rate of severe depression among girls increased by 58%. Many researchers believe the rise in suicide is a direct reflection of the negative effects of phone addiction. Signs and symptoms of phone addiction. There is a fine line between healthy and compulsive mobile use. Depending too heavily on a device can lead to mobile addiction. A scholarly journal published by the National Library of Medicine reports that 6% of the overall population is addicted to their smartphone. The pattern of abuse is the greatest among those under 30, with an average of 16% of adults addicted. So, chronic phone use is prevalent. How can you distinguish between normal phone use and phone addiction?
There are a few ways to discern if someone has signs and symptoms of a phone addiction. Lying about smartphone use, neglect or trouble completing duties at work, school, or home, more and more time using a phone, checking people's profiles repeatedly due to anxiety, accidents or injury due to phone use, working later to complete tasks, weak or non existent social life, a feeling of lack of connection, angry or irritated if phone use is interrupted, getting up at night to check a phone, reaching for the phone the moment they are alone or bored, and limiting phone use is difficult. It's essential to remember that there is no specific amount of time, frequency, or messages sent that indicates phone addiction. Yet, an accumulation of the above warning signs is an indicator of an underlying phone use problem. Phone addiction is pervasive. Still, there are ways to combat or treat the disorder. There are specialized addiction treatment centers that can help. Some of these detox centers offer a variety of programs to help their patients kick the digital addiction.
Few treatment approaches are available for treating people addiction like cognitive behavioral therapy, group therapy, marriage or couples counseling, group support, psychotherapy, motivational interviewing, and medication-assisted treatment. Don't let phone addiction win. Though smartphones are an excellent resource, they also can be potential dangerous tools, especially for children and young adults. The extent of issues that arise from excessive phone use is still not completely understood. However, as science continues to link health problems to cell phone use, it's essential to be proactive. If you are worried about yourself or a loved one, there are steps you can take. Don't let the phone consume anyone's life. Take an empowered step towards recovery, possibly by delineating a short time frame in which to complete an all-out phone detox. If that's not feasible for you or for the one with the problem, then bring as much awareness to the issue as you can. Sometimes being conscious of our issues and checking our behavior as best we can is all we can do. Thank you.